By Cassandra Susan, a nurse at Emmanuel Medical Center, located in Entebbe. Well, I want to talk about post-operative care. One would want to know what is post-operative care. So, post-operative care is the type of treatment or care given to a patient after surgery. So, this contains a lot that is done here. So I'm going to talk about it, mention some of the complications that are expected if not followed, if the steps are not well followed. So me as a nurse, what am I supposed to do when offering such a service to a patient? Well, the type of post-operative care depends on the type of surgery that has been done. Well, here at Emmanuel, perform a variety of surgeries. I'll just mention a few. So we have cesarean section, it can be cesarean section, orthopedic surgeries, it depends. So the type of care that I give as a nurse will depend on the type of surgery that has been performed. But some things are measured during this course of my service. So what are the things? Oh, the supportive. Mainly here, my duty, I give supportive care. I don't prescribe, that is not my work, it's for the doctor. So my work is to do what the doctor has instructed me to do and well monitor. What I see is deviating from the normal, I have to report. So what is this supportive treatment that I give? One, it involves vital signs. The vital signs that includes the blood pressure, includes temperatures, includes the pulse rate, includes the oxygen saturation. So normally there is a tendency of maybe sometimes the temperatures may rise or drop. So here it's when I come in. Mainly the normal temperature is 30 degrees, 36 degrees Celsius. So any kind of deviation I'm meant to report. Well, blood pressures may vary according to age. So any deviation from the normal, we have the normal as 120 over 80. So any deviation I have to report, the pulse rate. So as I told you in the beginning, that the type of management or the care that I give will definitely depend on the type of surgery that has been performed. There's some surgeries where a catheter has been inserted in the patient. So here I have the role of this catheter mainly to show us the urine output and how someone's kidneys are probably functioning. So here is when I come in. I expect as a monitoring, at least I expect 70 mils per hour per kg of a patient. So anything if I'm not getting anything of that kind, maybe the patient is dehydrated or anything, I have to report. Two, pain management. So we understand, like after surgery someone has got a pain, but during the course of the surgery or the procedure, pain is being managed. But you know, this drug wears out after its half-life. So this is when I come in, check on the patient. Is the patient reporting pain or not? So in cases where a patient is reporting pain, still I have to report that. Our work here is to make the patient comfortable. I don't think whether someone will be comfortable in pain, no. So this is when I come in. Pain management. Then 3 would be wound care. So having this person from surgery or from a procedure, all I want is to see the wound clean. How do I see that this person's wound is clean? It's clean, it's not draining. I look at the dressing that has been used in the theater. So I expect this area of the wound to be dry, not to be soiled with any kind of blood or anything. So this is all my duty, to find out, is the wound clean? That's all with wound management. Then my 4 would be nutrition. So normally, well, I've been clear, depends on the type of surgery that has been performed. So in most cases, they don't advise a patient to eat immediately after surgery. So this is information that maybe has been told to a patient, but at some point maybe someone has forgotten, or the caretakers are anxious, are like, no, this person has to feed. So this is when I come in, like guide them. No, we have to give this patient this kind of time. Maybe have some little sips. This can be soup, but probably we are advised to monitor, maybe calling the doctor to listen to the bowel sounds. It's mostly advisable to eat after the bowel sounds are back. That is nutrition. And then I look at activity. So after surgery, we don't expect someone to get paralyzed, or we expect our patient to be active. So I will not, if in case, I'm just supposing, if I wasn't offering this kind of service, definitely, how will the doctor know that the patient is able to do this or that? No. So this is when I come in, monitor. Some patients actually are always in fear. They're like, no, I don't want to walk, I don't want to turn, I don't want to sit. Probably because of the wound, they're scared. So my work here, I come in, reassure the patient. I'm like, it's okay to sit, it's okay to turn, it's okay to walk, though it's short distances and under my guidance. So probably that's all. There is a lot about postoperative, but that's all. Meanwhile, sounds like, okay, do they really offer all that? Yes, we do. We have monitors that do that guide us in all those vitals. We are well equipped. We're really enough in number. So in case of anything, any kind of surgery, you're really in safe hands. So I want to talk about the 5 P's that we normally follow as we are giving this postoperative care. We have pain management. We have pain management. Yeah, we give the recommended treatment, because here our work is to make sure the patient is comfortable enough till fully recovered. So we don't expect someone to complain of pain, because that's part of discomfort. 2, we monitor pulse. We really don't expect someone's pulse to be highly elevated, despite the fact that there were some changes during the operation and so on. So we meant to stabilize. It's part of the vital signs. Then 3, we look at, we don't expect one to be paralyzed after surgery. So in case someone gets paralyzed and there is something to do with the neuron, so this is my work to come in as someone is able to do the vital movements, move his hands, the head, the fingers, the patient is active. Then 1 could be pain still and temperatures. We don't expect the patient's temperatures to fully drop. So here is my work. I come in, monitor, make sure everything is okay. That is all I can give. Then maybe I can mention a few of the complications related to postoperative care. So just in case you haven't been keen when you're handling your patient, or some of the complications, there is shock. This shock comes in, it can come in as a result, maybe someone has lost a lot of blood and you people haven't noticed it. Someone has, maybe the temperatures have dropped so low and maybe one has not been in position well. I'm just mentioning it. It doesn't happen here at Emmanuel. Now we look at infection. If the patient's wound has not been fully monitored or looked after very well. So I've mentioned this case because what I'm describing now is this immediate care that is given to a patient after surgery. And then I'm discussing about some of the complications if not fully given, if I've not fully given the patient this attention that she or he really needs. So infection is part of them. For example, you haven't checked on the patient's wound, it is swelled and everything. So we expect the place to be clean and dry. So I'm looking at a situation, the wound is wet, maybe blood has somehow entered the wound and so on, maybe urine, anything. So that can cause infection. So and what else? Talked about the elevated temperatures. If not fully monitored, that's also another complication. What can I say? Some other few things, maybe if the caretakers are not fully informed. For example, you haven't told them, you haven't discussed the diet of the patient, how the patient has to eat, and the activities that the patient has to do and what not to do. Yeah, it can also cause two issues. So I can also pulmonary embolism, DVT, a lot can happen. Lung complications, and then there is also a tendency where a patient reacts to the type of anesthesia given. So if you haven't taken it fully in caution, maybe to monitor the patient and so on, you may not notice. So at times there is getting spinal headache. Well, this is where I have to come in, rehydrate the patient, reassure them, tell them to drink a lot because drinking has never been harmful. Then sometimes itching. This is when I come in, I'm like, inform the doctor this is happening to a patient, and maybe give something, an antihistamine, for example, to stop that. Well, that's all I have. I'm so grateful for your time, and I welcome you at Emmanuel. Feel at home. We have a great team, we have great nurses ready to take care of you and reassure you we're here for the perfect health.